parties, open shops, and not that many masks. Sweden's approach to COVID-19 is radically different. It's relied on people taking personal responsibility to contain the virus instead of strict lockdowns. But Sweden now has one of the highest transmission rates in Europe. Only its well-funded healthcare system and sparse population have stopped deaths rocketing to the levels of Italy or Britain. Now Stockholm has become a haven for young people from other countries escaping lockdowns. Is there anything we can learn from the Swedish way? That's a question I'll ask a doctor at one of Europe's largest university hospitals in Stockholm in a moment. First, let's take a closer look at how the relaxed Swedes have been approaching the pandemic. The government has drawn both international praise and criticism for its decision to stay open during the crisis, and not all Swedes are convinced the country took the right path.
At first glance, this looks like life before the pandemic. Friends hugging each other and going on a shopping spree. In Stockholm, you're allowed to do this. Sweden hasn't imposed a lockdown. Instead, authorities rely on people to use common sense. And these young people see this as an invitation to come visit. Corey Marr says he came from Ireland 2 months ago to enjoy life and quickly found like-minded people.
It feels good to get a coffee, it feels good to be able to go to the gym, it feels good getting on a bus, it feels good getting on a train without being accosted by possible police members or possible security teams. It feels good to be alive, and it feels good to be like existing as a young person should be existing, you know?
Many of the other guests in this Stockholm hostel agree. They've come here from across Europe, from Italy, France and Germany. Many are fleeing the COVID-19 restrictions in their homelands.
When I arrived here, I simply discovered that here was full of other ones like me that were here from the same reason, so simply continue to be alive.
They live in rooms like this, with 8 beds and no windows, for weeks at a time. Linda came here after graduating from high school. When I came here a week and a half ago and saw people in restaurants talking and eating together normally without masks, I thought I was dreaming. On the other hand, I can't forget what it's like in Germany right now. Sweden has both mandatory and voluntary restrictions. Residents who can are asked to stay home. There's a ban on serving alcohol in the evening, and masks are only recommended during rush hour. There have been more than 12,000 COVID-19 deaths in a population of 10 million. This has left some doubtful. When 82-year-old Gösta Andersson fell ill, doctors refused to give him intensive medical care. But after pressure from his daughter, he received treatment. I was angry. I wondered if this really is the right way to go. Why are we doing this? It's not working. We know that young people can spread this disease, and the whole thing is far from over. It will keep us busy for some time to come. But Corey Marr is enjoying the freedom of the Swedish way, like going to a cafe or a bar. It's something the Irishman no longer wants to do without. So he can't imagine returning home anymore. Instead, he's looking for a job that will allow him to extend his stay in Sweden.
Karolinska University Hospital's Dr. Marie Holmqvist joins us from Stockholm, Sweden. As we heard in that report, it came down to the daughter's decision as to her father's treatment, but you say it should be a medical decision, not up to the relatives.
Well, yeah. Well, first of all, I would like to say that I'm very happy that everything ended well with this family, and it's very difficult for me to comment on a specific case like this. But there are some general aspects of intensive care that I would like to comment on with respect to problems that have occurred during the pandemic. As you allude to in your questions, deciding on who are treated in what level of care in Sweden is based on medical considerations, of course. Usually the decisions are made in a multidisciplinary team where several physicians together decide what's best in terms of treatment for the specific patient. Mm-hmm. The question that we're trying to address and when discussing this is what will benefit the patient the most. And sometimes subjecting an individual to intensive care is considered worth a try, meaning that the expected outcome will outweigh the risk that the treatment will expose them to. In the context of intensive care, this means that they have a good chance of surviving intensive care and returning to a life with a reasonable quality of life. If the team reaches that conclusion, then that subjecting the patient to intensive care will increase suffering and not have the sought-after consequence, meaning survival, they will decide not to move the patient to intensive care, primarily because it would be unethical to increase suffering without any hope of survival. So as you understand, these decisions are extremely difficult, and we include relatives in this discussion to make sure that they understand the reasoning behind the decisions, but we never ask them to make these decisions, since the ethical stress of having to do so definitely would be too heavy. So yes, it's a medical decision aiming to do what's best for the patient in the long run.
So tell me, how are things going in Sweden with this third wave now hitting?
Well, it varies a lot throughout Sweden. In some regions, the spread is increasing, while in others, the situation is under control. Here in Stockholm, where I am right now, we're seeing an increased spread and a larger proportion of tests positive of all tests during the last weeks, and we see a worrying influx of patients to the hospitals. But we are nowhere near the levels of hospitalized patients that we saw during the first and second wave. And we also are beginning to see a positive effect of the vaccinations. Mortality from COVID is definitely decreasing among those who have been most severely hit during the first and second wave. That is individuals who are older and who live in elderly care facilities, and I'm extremely happy about that. But at the same time, I worry about the pressure on the healthcare system building up again.
So tell me, did Sweden take the right approach in your opinion?
So what we did was in line with the Swedish preparedness plan for influenza pandemics that we had in place before the pandemic, the COVID pandemic. And it was approved by our parliament in time before the COVID pandemic. And it kind of sets the basis for how to deal with this situation. And we never aimed for suppression. But from the start, we've approached the virus with efforts to mitigate its effects, protecting risk groups and making sure that the healthcare system would suffice and be able to function at acceptable levels for all healthcare needs, including cancer and myocardial function as well. So the second thing to understand is that the authorities have since day one emphasized the need for public health interventions that are sustainable. And we need to induce changes in behavior that in the public that people will be able to keep up for a long, long time. To briefly answer the question, if I believe we have approached the pandemic correctly, I would say yes. I don't think suppression would have been feasible, given the fact that the interventions needed to reach suppression would have been associated with too high risks for us as individuals and for society overall.
Marie, just briefly, what can other countries learn from Sweden, do you think?
I wouldn't even think about extending recommendations to any other nation. We all do what we can to deal with this extremely difficult situation. And I wish and hope that we all will be able to look back on this awful time, extract what we need to be better prepared. And I hope that we together can form a plan on how to deal with pandemics in the future, and that we do so with a more global perspective encompassing, all parts of the world in our response.
Marie Holmqvist, thank you very much for being on the show today, joining us there from Stockholm, Sweden. Italy was home to a critical hotspot at the height of the pandemic's first wave. A year on, and despite strict lockdowns, over 100,000 people have now died from COVID across the country. The British variant of the virus is spreading there at what doctors call an alarming rate. The mutation now accounts for nearly 18% of all cases and could soon become dominant. Experts say Italy's hospitals could be overwhelmed again. Let's get you over to our science correspondent, Derek Williams. He's been fielding your questions on the coronavirus.
Why is the mortality rate for Europe and North America so much higher than in Asia?
After the first few months of 2020, most East Asian countries got their pandemic problems pretty well under control, and they've largely stayed that way. To try to answer this, I first checked the numbers, which even if you take into account a lot of unknowns and discrepancies, are quite striking. There really are huge differences between continents. All told, there have been around 10 times more deaths in Europe and the Americas than in Asia, although more than 3 times as many people live on the world's largest continent. We don't know why, but as always, there are some interesting theories. East Asian countries in particular have largely avoided the worst ravages. I think there's no question that that success is due, at least in part, to wide acceptance of strict social measures when necessary. But some researchers think that can't explain all of the disparity. One intriguing hypothesis is that historically, East Asia might simply be an area of the world where respiratory viruses like SARS-CoV-2 are more common in the environment. So spillover and minor outbreaks with novel pathogens like it happen there more often, but go unnoticed. Those events would, however, according to the theory, lead to higher levels of resistance in populations against those kinds of pathogens in general, lowering disease severity for many people when a big outbreak event occurs. That idea is pretty controversial, though, and it's really, really hard to prove. And since we know that mask wearing and contact tracing and targeted hard lockdowns work, many experts still give most of the credit for the lower death tolls in East Asia in particular to those kinds of measures.